Elderly health decline. 5 subtle changes families need to know. Have you noticed subtle yet consistent changes in an elderly loved one? Changes that seem small, but leave you with an uneasy feeling? Most people think death in old age comes quickly and without warning. But the truth is, the body often starts signaling its final chapter months, sometimes even a year before the end. The problem is that these signals are easy to overlook. They don't arrive with flashing lights or alarms. They appear quietly, disguised as normal aging. By the time most families realize what's happening, they're already running out of time to prepare, to say what matters, and to make peace. That's why it's so important to pay attention. When you can recognize the signs early, you're not just preparing for death, you're preparing to make life, even at the end, full of love, comfort, and dignity. In this expanded video breakdown, we'll explore 5 subtle but powerful signs that an elderly person may be in their final year. We'll look at what they mean, why they happen, and how you can respond not with fear, but with calm, care, and presence. If you've been noticing changes in someone close to you, this may be one of the most important videos you watch. Let's begin. 1. Significant. Unintentional weight loss. Weight loss in the elderly is often brushed off as normal or even healthy, but when it's unintentional and persistent, it can be one of the clearest signs that the body is slowly shutting down. At first, it's subtle. A person's pants fit looser. Their face looks slightly thinner. They begin pushing food around their plate more than eating it, but this isn't about vanity or dieting. As people age, their metabolism slows, digestion weakens, and nutrient absorption drops. When the body starts entering its final stage, it deprioritizes hunger. Appetite fades. The sense of taste dulls. Eating becomes more of a chore than a pleasure, even when families try to intervene by offering high-calorie drinks, preparing favorite meals, or feeding smaller portions more frequently. Weight continues to drop. This is because the body is no longer converting food into fuel the way it once did. Muscle mass shrinks, strength fades, and immunity weakens. Sometimes, underlying illnesses like cancer, heart failure, or kidney disease are at work, silently progressing and using up resources faster than the person can replenish them. Other times, mental health plays a role. Depression, confusion, or even grief can dull the will to eat. Rather than forcing food, caregivers should focus on comfort. Think soft textures, favorite tastes, and hydration over nutrition. The goal isn't weight gain, it's preserving energy, reducing distress, and honoring the person's experience in these final phases. 2. Persistent fatigue and physical weakness. Fatigue is something we all experience, but for someone nearing the end of life, it goes far beyond tiredness. This kind of exhaustion doesn't improve with rest. It's the kind that makes getting out of bed feel like climbing a mountain. The body, knowing its reserves are limited, begins conserving energy. The heart beats slower. Blood circulates less efficiently. Oxygen delivery drops. Simple tasks like brushing teeth or walking to the bathroom become overwhelming. As a result, the person may start sleeping longer during the day. They may seem alert in one moment, only to drift off mid-sentence the next. It's not a lack of interest, it's a protective mechanism. The body instinctively pulling back to rest. This fatigue also affects the emotional state. People become quieter, less willing to engage, and more withdrawn. They might avoid visitors, decline outings, or seem indifferent to what's happening around them, not out of rudeness, but sheer depletion. For caregivers, it's crucial to adjust expectations. Don't push. Don't urge them to be more active. Instead, create soft moments, holding a hand, sharing a story, or simply sitting together in silence. These are the memories that linger, long after words and energy are gone. 3. Cognitive confusion and emotional withdrawal, another deeply human sign that a person may be in their final year is a noticeable change in how they think, communicate, or emotionally engage. Perhaps they begin forgetting appointments or names. They may struggle to follow conversations, or they may repeat themselves without realizing it. This cognitive decline isn't always due to dementia. It can be the result of reduced oxygen flow to the brain as circulation slows down. Emotionally, they may become quieter, less responsive, and less interested in once loved activities or people. You might notice them sitting in silence for long periods, avoiding eye contact, or seeming lost in their own thoughts. This withdrawal is not necessarily depression. It can be the brain's way of shutting out excessive stimuli during a time of reduced mental capacity. During this stage, moments of clarity might come and go, alternating between awareness and confusion. What matters most is creating a space of gentle understanding. Speak in a calm voice, use familiar words, and never underestimate the comfort of your presence, even if they don't respond the way they used to. 4. Frequent infections and slower healing. As the body weakens, the immune system begins to fail. You may notice that your loved one catches every cold, takes longer to recover, or develops frequent urinary tract or respiratory infections. Even minor wounds, like a scratch or bruise, seem to linger for weeks instead of days. These are not random occurrences. They are signs that the body is losing its ability to repair and protect itself. When the immune response slows, infections become more common, and even medications seem less effective. Sometimes the only sign of infection is a drop in energy, or a sudden change in mental alertness. At this point, comfort care becomes more important than aggressive treatment. Focus on keeping your loved one clean, comfortable, and hydrated. A warm blanket, good hygiene, and soothing words often provide more relief than another round of antibiotics. 5. Changes in breathing and circulation. One of the most visible signs that someone may be in their final weeks or months is a change in their breathing patterns. You might notice irregular breathing, sometimes rapid, sometimes with long pauses in between. This is often called Cheyne-Stokes respiration and is common in end-of-life stages. Circulation also begins to slow, particularly to the extremities. Hands, feet, and even the nose and ears may feel cold or look bluish. The skin may appear blotchy or mottled. These are signs that the heart is no longer pumping efficiently and the body is focusing on protecting core functions. This can be frightening to witness, but it's part of the body's natural process. In these moments, your presence matters more than your actions. Offer small comforts. Adjust their position, provide a cool washcloth, or simply sit beside them in silence. Recognizing these 5 signs: unexplained weight loss, persistent fatigue, cognitive changes, increased infections, and altered breathing and circulation can help you prepare not just practically, but emotionally and spiritually for what's ahead. While it may be painful to accept, being aware allows you to offer your loved one what they need most: peace, dignity, and love. Instead of fearing the signs, let them be a gentle reminder to slow down, lean in, and cherish the time you have left. Because in the end, what matters most isn't how much time remains, but how fully we love through it.